the Asian Culture and Education Society, USA. My name is Zach Lightfoot. So this is our volunteers. We're made up of a lot of different members from across the community. Our volunteers are a special group of people from all walks of life and all ages who've come together because they care about their communities and their fellow people. We have volunteers as young as 5. So really no volunteers are too young if you really want to get involved with your community. As you can see through our slides, we volunteer everywhere from hospitals to police stations to fire stations, delivering food and other supplies. Our group has been very active during the pandemic. We have been very busy providing PPE, which is personal protection equipment, to local hospitals, fire stations, police departments, and doctors' offices. We've tried our best to support the first responders and people in our community who are on the front lines fighting this pandemic. We've worked with local government officials to help in the community, and we've actually joined local officials to help provide meals to those in need as well. Another important contribution our group has made is making and delivering meals to hospitals, police stations, fire stations, doctors' offices, and more. By working with our partners in the community, we provide a little more hope to those on the front lines. Real benefit of joining our group is that it has been hard as a student and young people to find different ways to help with this pandemic. But our group provides so many ways that others can participate and join. Our group here is here to offer help to our community and to the people who have been affected in many different ways. People who've lost their jobs and their homes. We are here to provide assistance and help in any way we can. In the summer of 2019, some of our members were fortunate enough to travel to China to help and volunteer in those communities as well. Our members were responsible for donating school supplies, taking photos, making albums, even teaching some children. It's an amazing opportunity, and these photos show just how much our volunteers and the children, how much of an enjoyable time our volunteers and the children had together. Here's just some other photos from the trip. As you can see, our volunteer Samuel was a big help throughout the process. Our group members also participate in many different activities. This summer, our DI team won 17th place in the global competition. We are participating in the Wharton Global High School Investment Competition this year, and we helped with the census, cycling club, football club, and other various competitions throughout our community. So as we said earlier, we're always looking for new members to join and other people who are actively interested in pursuing the community. You can follow this link to go ahead and sign up if you're interested. And we're always happy to respond to answer questions or things like that at either the phone number or the email. And then obviously we have a lot of activities as a group. We've done plenty of other things throughout the community related to public health, sports, medicine, and just plenty of other things. Just coming together as a community. Oh, again, we'd like to thank our partners who have helped us throughout this pandemic, such as USA Bank and Texas Instruments. And it's just such an honor to be working with some of these great companies who've helped provide for us. And we're always looking for other supporters if you're interested. Now we'd like to have one of our youth council members, Carter, introduce our featured speakers, Zihan Zong and Mrs. Millie Lee. After a questions and answers session, we will resume with Dr. Riva. And now I'm going to hand it over to Carter for our first speaker.
Hello, for any new joiners, my name is Carter Mank. I am a Hillcrest High School International Baccalaureate program student, and today I have the pleasure of representing the Asian Cultural and Educational Society, USA, in introducing Dr. Riva as one of our speakers today. Dr. Rall is board certified in internal and emergency medicine. She earned a double bachelor's Bachelor of Arts at Rice University and a Doctor of Medicine from the University of California, San Francisco School of Medicine. Dr. Rall completed her emergency medicine residency and served as chief resident at the University of Texas Southwestern Medical Center in Dallas. She is the on-site medical director for the Cooper Wellness Program at the world-renowned Cooper Aerobic Center located in Dallas, Texas. For over 15 years, Dr. Rall has dedicated her expertise to supervising, counseling, and providing medical oversight to the center's medically based lifestyle program. She represents the Cooper Center and a physician's point of view as a guest lecturer and author in Living a Healthy Lifestyle. In her spare time currently, and for over the past decade, Dr. Rall has also given back to the medical community by teaching and working in the ER. She is a clinical professor and on faculty in the surgery and emergency departments for UT Southwestern and Parkland Hospital, respectively. She is a part-time staff physician in emergency department for EMC, working at Texas Health Presbyterian Hospital at Rockwall. Time because she is a great mom of two boys, Evan and Reagan. Please join me in welcoming Dr. Riva Rall, our guest speaker for today.
Thank you very much. When Jan asked me to talk to this group, I thought it would be a good opportunity to share some basics about the health issues that are facing us today, and also the things that we can do. I think we're kind of at a crossroads, not just with our nation and the global health with the pandemic, but also with what I would consider also the global pandemics of obesity, diabetes, and stress, which I think are affecting us just as much as the current viral global pandemic. So I wanted to just do kind of an oversight. At this time, I don't think we need to lose sight of everything else that's going on in this world just because we have a global viral pandemic. And so I wanted to review a little bit of both of those things. And let me see if I can pull up I'm going to try to pull this up here. See if it will.
Yes, it works.
Make it big. Let me see if I can do that. Let's see. Is that a little bit better? Can you see this? So I wanted to title this Your Prescription for a Healthy Life and the ABCs. And for me, I always think it's easier to talk about things if we can remember them. And so I wanted to start with the ABCs. Just get through here. Let me close this because there's a little bit of noise. All right, so starting with A, I think the most important thing we can do is avoid tobacco. Smoking, vaping, e-cigarettes, I think it's more of a problem for youth today, but tobacco is actually responsible for more deaths and more medical problems in the United States than any other entity, including overweight, diabetes, poor lifestyle things. So A is for avoid tobacco. Currently, smoking and other forms of tobacco are responsible for about 500,000 deaths annually. And you can see the breakdown here. Some are cancer, some are heart disease, and some are lung disease, and then CVD is stroke. These are major issues, and this is something we have control over. B is for blood pressure. If I could see everyone and ask people to raise their hand, I would say, how many of you know what your blood pressure is? It's important to know your blood pressure. And I show the picture here of a blood pressure monitor because I think it's important that people who have been borderline consider having a blood pressure monitor at home so you can know your numbers. We all know our numbers for a lot of things now that we have Fitbits and Garmin's, and even the Apple Watches can tell us a lot of things. But it's also important to know your numbers about the blood pressure because oftentimes your blood pressure can be elevated and you won't even know it. That's why they call it the silent killer. I wanted to talk a little bit about white coat hypertension. And again, if I could have a show of hands, I bet a lot of you would raise your hand that when you go into a clinic or you check your blood pressure, or even when they check it at the dentist, your blood pressure may be mildly elevated. But if you check it at home, it's always normal. We call this white coat hypertension because often when you're in the setting of someone wearing a white coat, it tends to be higher. But even if your blood pressure is normal the other 364 days of the year, it doesn't mean that you're not at risk. So it's important to know if you do have blood pressure that's borderline in some situations, that you really should keep a close eye on it and do some of the lifestyle things I'm going to talk about in order to reduce your risk. Blood pressure is so important because your blood pressure affects so many different organs. It affects your brain, it affects your heart, it affects your kidneys, it affects a lot of your other peripheral organs, and your skin and your nerves. This list here is quite a long list. This is a list of things that affect your blood pressure. A lot of us know about diet and salt intake. And I will say, culturally, I think sodium is, at least when I've gone to conferences in Asia, there's a big focus on sodium because I think it's a large part of diet and preservatives. The sodium and salt can affect blood pressure for about 1 in every 3 people. And so if you do have blood pressure that's borderline or elevated, it's important to take a look at the salt and sodium in your diet. And it's not that you necessarily have to be adding salt, but a lot of foods, especially foods that are prepared or with preservatives, often have quite a bit of sodium in it. The biggest source of sodium in the American diet is actually bread. Your salt affects your blood pressure, so does your body fat. Exercise affects blood pressure in a positive way. When you exercise, your blood pressure will go up, but that's normal. After you finish exercising, your blood pressure will actually go a little bit lower. I call it an overshoot. Your blood vessels open up and dilate, and you actually end up with a blood pressure that's about 6 to 10 points lower than it started before you exercised. That effect of exercise actually lasts about 23 hours, which is why it's so important to get some sort of exercise every day. Stress is in bold. Stress affects your blood pressure tremendously. Stress is present for all of us right now. We all have had stress, and then this global pandemic has added quite a bit of additional stress. One of the things that, one of the things that affects stress is your perception of stress. If you can find ways to manage your stress, you can probably reduce your stress. Everybody manages stress in different ways. I think it's important to find what works for you. Some people meditate, some people do yoga, some people do Tai Chi, some people go for a walk, some people listen to music, some people spend time with their animals. Some of the ways that we manage stress may not be available to us right now in the pandemic, but I think it is really important to consider that you should control your stress if you can, and be aware that you have stress, because stress definitely can affect your blood pressure. Alcohol raises your blood pressure too. On average, alcohol, drinking 1 serving a day, can raise your blood pressure between 6 and 11 points. So if you drink too much alcohol and your blood pressure is a problem, you can reduce your alcohol intake. Genetics, I always like to focus on genetics because I think there's a definite contribution of family history, but just because you have a family history of some sort of blood pressure issue doesn't mean that you'll necessarily have blood pressure. It just means that it's important for you to manage this as best you can. And then the last thing is tobacco. Going back to what I said before, tobacco is responsible for a lot of health problems in this country and worldwide. And one of the reasons it does that is by affecting the blood pressure. Okay, can everyone see? Zach or Carter, can you give me a thumbs up if you can see the slide that says cholesterol? Okay, we're on to C. A was avoid tobacco, B is blood pressure, and C is cholesterol. There's different types of cholesterol. Sometimes it's hard to remember which one's the good one, which one's the bad one. And I want to say that the HDL is your healthy cholesterol and you want it to be high. And your LDL cholesterol is your lousy cholesterol, the one you want to be low. How high or how low these need to be depend on your risk factors, and you can talk to your doctor about it. The triglycerides and the VLDL are actually related to each other, and that's kind of like everything else. But the big thing is making sure your HDL is healthy and high, and your LDL, which is your lousy cholesterol, is low. The things that affect your cholesterol and your triglycerides are very similar to the things that affect your blood pressure. The diet definitely plays a role. There are certain types of fats that will increase your bad cholesterol more than others. These include lard, these include coconut oil, these include butter, and these include trans fats. There are certain types of fats which are healthier. These are omega-3s, which are found in fish, nuts, olive oil, avocados, those sorts of things. An excess of sugar, an excess of alcohol, and an excess of simple carbohydrates can raise your triglycerides. So what are we supposed to do? Because it seems like everything is going to cause a problem. Well, exercise seems to be the answer for everything. Now it's really interesting. Aerobic exercise like walking or running or swimming or something at the gym or a rowing machine will raise your good cholesterol and it will make it higher and healthier. Strength training like calisthenics, weight training, yoga, Pilates, these sorts of things will lower your bad cholesterol. That's why you need to get both types of physical activity. Your body weight will also affect your cholesterol because the more fat you have on your body, the higher your triglycerides will be and the lower your HDL or good cholesterol will be, meaning that you don't have enough of the healthy things. And of course, genetics. When in doubt, you can always blame it on your parents. All right, so D is for diabetes. This is a global epidemic as well as it is nationally an issue. There are different ways that you can be diagnosed with diabetes. If you go see your doctor, my guess is if they do blood work, they will check one of these two tests. The glucose is your sugar marker, and then this measure here called the hemoglobin A1C measures your overall glucose over a 3 or 4 month period. So it gives you a really good bird's eye view of how things are. The list of who is at risk for diabetes basically includes everyone. If you have high blood pressure, if you're overweight, if you don't get enough physical activity, if you have a family history, if you're a woman and you had problems with gestational diabetes during pregnancy, you could be at risk for diabetes. And if your cholesterol is not perfect, if your good cholesterol is too low or your bad cholesterol is too high, you could be at risk for diabetes. These maps are markers of the prevalence of diabetes in this country. And you can see 30 years ago, in the 1990 picture, very few states had even above 6%. That's what the dark blue is. There were just a handful here that had above 6% of the population had diabetes. When you look 5 years later, all of a sudden, including our state here, Texas, many more states had at least 6% diabetes. Then 20 years ago, most of these states had at least 6% of the humans in the state of diabetes. When we go a year further and we divide it even more, you can see here, 20 years ago, There were very few states that were even, a few states here, and these are states that don't have very many people in them, that had less than 5% diabetes. And some states down here in the southeastern, greater than 10%. I will tell you today, 14.1% of the US population has diabetes. 14.1. So in 20 years, we've gone from just a handful of states having more than 10% to, as a nation, about 1 in 7 people has diabetes. And this is just another interesting map. This goes back to just seeing over time from the 90s, 2000, just how things have changed tremendously as the country just becomes darker and darker and higher rates of obesity and diabetes. Like the blood pressure, diabetes affects nearly every organ. And you can see here that the brain is affected. If you have diabetes, you're at much higher risk for stroke, the heart. Here's a really interesting fact. If you're a diabetic today, your risk of having a heart attack is higher than someone who's already had a heart attack. That's how diabetes affects you. So it's really important to prevent what you can and control what you can. The risk of complications is tied to the control of your glucose. So just because you have diabetes isn't necessarily a problem if you can figure out how to control the blood sugar through lifestyle medication or however you choose to do it. And I will say that lifestyle, the things that you choose to do, what you eat, how you exercise, and how you manage your stress all play a large role on how you control your blood sugar or glucose. Let's see. So I want to just talk briefly about something called cardiometabolic risk. It's a dangerous cluster. There are 5 things, and they're all out here. It has to do with your blood sugar, your waist, your HDL cholesterol, that's your good, healthy one, your triglycerides, and your blood pressure. And you can see here, none of these are really that far out of range, but if you have many of them, you greatly exponentially increase your risk for heart attack and diabetes. It's called insulin resistance, the metabolic syndrome, or syndrome X. What does this mean? Like I said, it has to do with your propensity for heart disease and diabetes. If you have 3 of those 5 things that I had on the screen, you have a 76% increased risk for heart disease and 250% increased risk for diabetes. If you have 4 or 5 traits, you have a 25-fold risk for the development of diabetes. This little map here talks about your cumulative risk for dying from heart disease if you have metabolic syndrome. And every year, people with metabolic syndrome versus people that don't just escalate their risk of dying from heart disease. So it's really important to be aware of these things. What should we do? Well, know your numbers, know what the 5 traits are, and know what your numbers are. These are things you can get with your doctor or even at a health screen. Correct those that you can through weight control and exercise. If you have 3 or more, again, blood pressure, waist circumference, the triglycerides, good cholesterol, or sugar, consider medical intervention, like medication if you need it, but be very specific with your doctor. Also treat other cardiovascular risk factors aggressively. That includes your bad cholesterol. So maybe statin. I'm not someone that likes prescription medications because I think lifestyle can help a lot of things, but if you need a medication, I would rather that you have the medication than have a heart attack. Also, baby aspirin can be very helpful if you're at high risk for heart disease or diabetes. Now we're on to the letter E. E is for exercise. For those of you that know me, this is one of my favorite things. I think exercise is so important, and exercise is really one of the best forms of medicine. I think this is a funny slide. The doctor asked me to spend at least 1 hour per day on the treadmill. So how much exercise do we need? Well, about 12 years ago, finally, the physical activity guidelines for Americans were released because there was a lot of confusion about how much exercise we needed. Did we need 30 minutes 5 days a week? Did we need 90 minutes every day? There were conflicting studies and conflicting guidelines for various people. So the sum of these guidelines was published in a 638-page document, but I've boiled it down to 1 or 2 slides for you. And it's quite simple. What you need to get for an adult is at least 150 minutes a week of moderate intensity activity. That's like walking. Sounds like a lot, but it's really only 21 minutes a day. So I always say, walk your dog twice a day, whether you have a dog or not. 21 minutes a day adds up to 150 minutes a week. Of course, more is better. 300 minutes a week would be better than 150. Also, you can see here, it's important to do muscle strengthening exercise to prevent bone loss, to prevent muscle loss, and to help keep your cholesterol down. It will also boost your metabolism. It will reduce your risk of falling. These guidelines are based on the evidence. This is not based on some experts getting together and guessing what they want people to do. This is based on what physical benefits to your health you can get from different doses of physical activity. And they really have studied exercise and physical activity in a dose response type of way. So I'm assuming, I know Carter and Zach are on here, and there may be people that have kids. Also, the average child watches 23 hours of television and at least 5 hours of screen time. Kids learn from us. People don't play outside as much as they did. In the past 20 years, childhood obesity rates have basically doubled. The guidelines, the physical activity guidelines for Americans that I was talking about on the last slide, they say kids should get at least 60 minutes a day. I know that was hard in the spring with the pandemic. Everybody felt like they should be inside, but the reality is you can just go outside, play basketball, walk your dog, ride your bike, that sort of thing. More than 60% of adults don't get enough, and 25% don't get any at all. So these are just some other guidelines about weight loss and exercise, but essentially, if you really want to lose weight, you're probably going to have to do more than 150 minutes a week. I like this. What fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? So there's 3 types of exercise: aerobic exercise like walking, running, swimming, riding your bike, jump rope; strength training, which can be weights, bands, kettlebells, calisthenics, push-ups, sit-ups, squats, yoga, Pilates, that sort of thing. And then flexibility. And there's some things like yoga that really take all 3 components. There's some that are 2. Tai Chi may be strengthening and flexibility. We talk about frequency, intensity, and duration of activity. You can work out harder. You could run for a shorter amount of time than walking slowly and get the same benefit. Exercise not only helps you live longer, on average 1 or 2 years living longer, but also the quality of life. And I think this is really important to all of us. We want to live well and we want to enjoy our time. And so the 8 to 14 years extension of independent quality of life, I think, is very important and very, to me, that's very motivating. So I think that's important for E. Let's see. F, we're not going to go all the way to Z, I promise. F is fat, avoid obesity. And I will briefly go through this because the obesity trends in adults are almost the exact same trends as that for diabetes. You can see here, 30 years ago, only a handful of states, thank goodness Texas wasn't in that yet, had at least 15% of the population here overweight. All of a sudden, within 7 years, then a bunch more states, only a few states had less than 15%. And then this is not the election results, but this is the obesity trends. This is, again, 20 years ago. Now we found that in our country, currently 36% of the population is obese now in 2020. And you can just see this part, we're knocking on the door here, and this was 8 years ago. I don't know if I have any more recent slides, but it's, here we go, 2015, 5 years ago. I mean, this is a major issue. So 61% of adults are overweight or obese. This is the key thing down here. Triple the amount of kids have gone in just the last 20 to 30 years from overweight to or obese. I think we're just eating too much. So why do we care? I mean, one, we want to fit into our clothes, but two, like I said, the obesity risks very closely correlate with that of diabetes risk. If you have a normal weight, the age of 18, you have a 1 in 5 chance of being a diabetic in your lifetime. The more you weigh, if you're very obese at the age of 18, almost guaranteed of being a diabetic. And that's very similar for women as well. I'm going to go back to A. I told you I wouldn't go all the way to the end of the alphabet because I'm going to talk about some more things. But A, I want to talk about alcohol a little bit more because we always hear a glass of wine a day is good for us. And I want to just briefly talk about that. So everything in moderation. And while alcohol may have some benefits, it should be minimized. The good news is it may help your HDL. And you remember that's your happy, healthy cholesterol you want to be high. And if it does, then it may help reduce your risk of heart attack, stroke, dementia. But if you're drinking more than that, you may have problems that are even worse because alcohol will raise your triglycerides. And so that causes another problem with the cholesterol profile. Also, alcohol significantly increases the risk for many, many cancers. The big ones, breast, colon, prostate, and esophageal cancer. For example, in women who drink more than 3 drinks of alcohol a week, have a 25% increased risk for breast cancer, 22% increased risk for colon cancer. Let me repeat that. Women that drink more than 3 servings of alcohol a week have a 25% risk increase for breast cancer, 22% for colon cancer. Also, there's other major health risks, cirrhosis of the liver, pancreatitis. Alcohol definitely affects your sleep, which I'll talk about in a bit, can cause stomach problems, heartburn, that sort of thing.
Okay, Dr. Ra,
Yes.
3 glasses a week or 3 glasses on average a day?
3 glasses a week.
Wow.
More than 3 glasses a week will increase your risk for breast cancer, 25%. Will increase your risk for colon cancer, 22%.
Can I repeat this one? So, 如果你一周喝2到6杯是吧？然后你会增加你的乳腺癌的机会25%。If you take the drinks 2 to 6 every week, you have a more 25% compared to the others that have the breast cancer, right?
Yes.
Yeah. Okay.
And this is an old study from Harvard, and it was mainly in doctors, but they said, you know, the optimal amount is not that much. And now we think it may be even less. My doctor said only 1 glass of alcohol a day. I can live with that. That is not the size of the glass of wine that you can have 3 times a week. 1 drink is 5 ounces of wine, 1 ounce of liquor, and a 12-ounce beer. I think this is interesting. Thomas Edison years ago said this: the doctor of the future will give no medicine, but instead will interest his patients in the care of the human frame, in diet and the cause of prevention and disease. We knew this, but we don't seem to be doing this. I want to switch a little bit. And then I think what I'm going to do is talk a little bit about stress, and then we'll come for some question and answers, unless you'd like to take a quick break for questions here. Okay. See if I can, here we go. Oh, and I did want to talk about this because sometimes it gets overwhelming. All these things we have to do to take care of ourselves, all these things, we need to do exercise. We need to watch our saturated fat intake. We need to not drink too much alcohol. We don't have to be perfect. Perfection is not attainable. But if we chase perfection, we can catch excellence. And I think that's what I tell my patients a lot. I'm going to give you a list of 20 things to do. Maybe you can try all of them. And if you do a few of them, you're going to be better off than if you don't do any of them. This is a picture. Carter said he knows my older son. This was years ago when he was learning his ABCs. So I hope you guys learned your ABCs here. So I want to talk a little bit about stress. And I call this, what if you're too busy for too long? you're going to get sick. You definitely gain weight. Relationships start to fall apart. We believe that 85% of medical problems may be related to stress. And right now, with a global pandemic, I don't think there's a single person on this presentation that doesn't have some stress, whether you even recognize it or not. Here are some common symptoms of busy people. A lot of them are manifestations, not feeling well, headaches, stomach aches, depression, extreme fatigue. People end up drinking or smoking more than they planned, palpitations, anxiety. Here's some early warning signs. Your personal life, the people that you love most, relationships start to fall apart. You start to have difficulty sleeping. Stress may not make you have trouble falling asleep, but will make you have difficulty staying asleep. You may gradually gain weight if you're like most of us. I'm not the type of person that loses weight with stress, but some people do. People become moody, and it's just difficult you could become moody or too serious. Less social. Now, we're probably all less social anyway, but we at least try to get together virtually. But these can be signs of stress. Here's some more. In your professional life, staying at work too late, working all around the clock. I know this is a problem for a lot of people because we can't seem to shut down because we're connected to the computers, which we were before the pandemic, but we have to be connected to computers. And we feel like the difference between work and home somehow doesn't exist anymore. Always being available, postponing vacation. I mean, all of these things necessarily have happened with the pandemic. But, ask yourself these questions. Are these things that you do? Do you skip meals? Are you coming home late? Are you just working through meals? Are you constantly on your phone? Are you on your phone when you're in your car? Because that's another opportunity to get some work done. Do you end up skipping exercise, skipping time with loved ones, or not really paying attention to loved ones because you're multitasking? Every thought and every action in your body ends up giving you some sort of hormonal biochemical response because your mind and your body are connected. And so it's really important to think about the effects of the things you think and how you manage your stress, because it can really affect your blood pressure, your cholesterol, and a lot of other things. We've all heard of fight or flight. That is your stress hormones from too much cortisol and adrenaline. It's great if there is a tiger that you're being chased by, but it's not great if you have a lot of stress over time, and I'll tell you why. The physiologic impact of stress means that your heart rate goes up, your blood pressure goes up, you sweat more, you start breathing more, but then your blood sugar goes up, and then you become at risk for diabetes. When all of these things get more blood flow, there are some things that get less blood flow, like your digestion, like your immune system, and the production of endorphins, which are the hormones that make you feel good and give you happiness. Ultimately, if you have too much stress for too long, you can see the list of things here that happens. Your blood pressure goes up. You may develop heart disease, diabetes, inflammation, colitis, autoimmune diseases like lupus or multiple sclerosis, and even cancer. Also premature aging. Stress will cause not just gray hair, but wrinkles. Stress also makes us fat. There's a lot of data about the hormones and how they affect our appetite, how they affect our sleep, and how they affect our ability to accumulate fat. There was a great study from the place where I went to medical school in San Francisco that even women who are lean, who are under stress, develop belly fat. And belly fat is a dangerous type of fat. So here's the bottom line. Chronic stress causes problems. It raises your risk for heart disease and stroke. It slows down your metabolism, and it causes you to be hungry and eat junk foods that probably don't have as much nutritional value as other foods. So what happens if you're too busy to eat? Find ways to get healthy meals quickly. I think the most important thing, if you don't remember anything else about diet, is that it is extremely important to eat breakfast. It's called breakfast. Break the fast. Eat something, even if it's a bowl of rice, a protein bar, a bagel, something that just something small. There are good things like Greek yogurt, some fruit, something like that. Get some fuel in your engine. It will start your metabolism for the day. It will give you some energy to your body so that you're not slowing down your metabolism. Lunch can be whatever you want it to be, but I always say if you don't have a ton of simple carbohydrates, you'll have more energy in the day. So it's a good idea to have some fruits and vegetables, and then maybe some protein, whether it's fish or beans or chicken or eggs. I think it's really important to keep healthy snacks on hand. My kids laugh at me. We travel all the time. I always have a bag with snacks, whether it's nuts, dried fruit. It's like the bottomless pit of snacks, because I'd rather have them eat the snacks that I provide, vegetables, fruit, nuts, healthy things, than what else we might find on an airplane or at a convenience store. And these are some good things that you can keep around: yogurt, Greek yogurt, fruit, crackers, hummus, that sort of thing. If you don't even have time for a break, find small, short ways that you can manage stress. Turn off your computer for a minute, close your eyes, take some deep breaths, do some things like this, get up and move. It's easier to get up and move now than it was when we're doing virtual meetings. I have a lot of patients that say they just put their headset on and do a Zoom meeting for 60 minutes out walking in the neighborhood if they don't need to have a lot of paperwork. Remember to stretch if you can. Music, if you can have background music, is very soothing and stress managing to people. Music has been shown to lower your blood pressure. Take a minute, take 2 minutes, whatever you can. If your stress gets out of control, a lot of other things can get out of control. You eat too much, you drink too much, spend too much mindless time on the internet, social media. Some people end up shopping too much online since we can't really shop in person. Find ways to work in a little fun. Some of these you can't really do very safely, like dining out or sporting events, but reading, music, spending time with your pets, doing activities, doing things in your garden. Find what feeds your soul and do it. Talk to your friend, Zoom with your friend. There are lots of things you can do. If you really don't have time to get physical activity, just start slow, because any little bit of physical activity is better than none. Start with 10 minutes a day. And just by doing that, you may feel better and end up wanting to do more, but just that small amount will really stimulate your health and can give you significant benefits, even if you aren't at the finish line of what you really want to do. So there are ways you can burn off stress through exercise, and this just gives you some ideas of some things that are fight or flight. But both the muscle strengthening and the aerobic exercise are important. When you get exercise, you'll boost your productivity about 15% according to the studies. This study was out of the United Kingdom, but it shows improved memory, more efficient multitasking if you believe that people can multitask, better mood regulation, and easier to process the information that you are getting. Also, just a plug to put in to be there for your family, because your family can be there for you. Try to find some time every day away from electronics, away from work, and give love, receive love, and that will help lower your blood pressure, help with your stress. Take vacations. Well, this isn't that easy to do now, but we can find ways that we can do safe vacations within the paradigm of the pandemic. But people who take vacations tend to have a lot less stress, improved sleep, and ultimately then some health benefits like a reduction in heart disease risk. And so therefore can add a lot of years to your life. Sleep, I told you I would talk a little bit about sleep. If you don't get good sleep or you don't get enough sleep, it will cause you to be overweight, diabetes risk, heart disease risk. Why? Well, if you don't get enough sleep, it's going to decrease your metabolic rate, and therefore you can increase stored fat, but also it affects your endocrine organs and therefore your hormones. So you'll have, for men, lower levels of testosterone, higher levels of blood sugar. And as a result of your endocrine organs not functioning well, you can increase your risk for autoimmune issues. We need the most robust immune systems we can right now to fight the virus if we're exposed. Good sleep is a very important part of that. At the bottom of this slide, we have what's called low leptin and high ghrelin levels. And I'm not going to get into all the details, but these are the two competing hormones that affect your fullness or satiety and your hunger. And so what ends up happening if you get poor sleep, you end up more hungry and you don't ever feel full. And so therefore you end up eating more, which compounds the problem of gaining weight. Exercise is one of the best ways to help you sleep. This study out of Stanford just basically shows not only do you fall asleep more quickly, but you will sleep longer. I'm about to sneeze here. And so, excuse me, people who exercise routinely will sleep more and better. It's cheap. It doesn't have any side effects. So it's important. A lot of people say, what time of day is the best time of day to exercise? Do I exercise in the morning? Do I exercise at night? To me, my answer is always the best time of day to exercise is the time when you will do it consistently. For me, that's first thing in the morning. For some people, it's at 10 p.m. I could never exercise at 10 p.m. But if that's the time where you have time and you're going to do it, then that is the best time for you. There's no difference in when you exercise as long as you get the exercise. Here's some things that help people sleep. Making sure your room is cool and dark, maybe taking a hot bath or shower before, spend time with your family or your pet. Don't have your screen on or violent TV right before bed, and don't be thinking about work. Some late night snacks can help stabilize your blood sugar and make it easier for you to sleep, and these are listed here. So I would challenge you over the next several weeks, try to eat smarter, more fruits, vegetables, and less processed foods. Try to find ways to manage your stress that will work for you. Try to get at least 10 minutes a day of physical activity. More is better. And then plan your day with an endpoint so that you can sleep, so that you can reset. And just try to find small areas and ways that you can appreciate life and the little things. Because right now we don't really have a lot of big things. And then just try to get sleep at night. And hopefully this will help you with your family, your work, and your health. So I'd like to open it up to questions at this point.
Thank you so much. I appreciate you are here. So it's great. Okay, here is a question is, diabetes become larger and larger over time? What mainly makes the population of diabetes become larger and larger over time? Yeah, number
Okay.
2.
So the reason that the population has become higher in the prevalence of diabetes simply has to do with the population has gotten more and more overweight and obese. And so as our weight goes up, our risk for insulin resistance goes up, and that is exactly what causes type 2 or adult onset diabetes. It's absolutely about the weight. Do you want me to answer the other questions? Because I see it in the group chat.
Yes.
So the question is, alcohol affects blood pressure. Can drinking red wine moderately lower blood sugar but have little effect on blood pressure? No. And there's no difference between red wine or white wine or liquor or beer in terms of blood pressure or blood sugar. There is some evidence that there's some antioxidants in red wine as opposed to some of the other types of alcohols that may reduce the risk for oxidative damage, but the benefits are far outweighed by the risks. And so red wine will raise your blood pressure and will raise your blood sugar. The next question was, do people with a low body mass index, less than 18.5, have a lower risk of diabetes or breast cancer? Absolutely. Absolutely. Both diabetes and breast cancer are greatly increased in people who are overweight or obese. A low BMI we would consider normal, between 18.5 and 25, will have a lower risk. There is some evidence that if you're what I call ultra lean, that there will be a lower predisposition to both diabetes and breast cancer as well. With the diabetes, it has to do with insulin resistance. And with the breast cancer, it has to do with the fact that the more fat in your body, fat is where estrogen is produced, one of the places. And so therefore, more fat in the body will lead to higher levels of estrogen, which can increase your risk for breast cancer. There's another question. What's the definition of high blood pressure? Is it 140 over 90 or 130 over 85? Actually, now it's, if it's higher than 120 over 80 is the definition of high blood pressure. 120 over 80.
I have a question is, what happens if there is too much stress for too long?
Overweight, stress will cause high blood pressure, can increase your risk for heart disease. You can have a higher risk for autoimmune diseases. You can have a higher risk for things from low immune system function, like viral infections, mono, those sorts of things. And then you don't sleep well, you gain weight, and the health problems will compound themselves.
Okay. Actually, I gain a lot of weight.
It's time to start walking every day.
Working every day. Yeah.
Hey, I have a question that, given that we're in COVID and some people are more group sports oriented than others, but that's how they would get their exercise. Are there some good activities for those that like a group sport that they could be thinking about?
Well, it depends on what group sport. You know, if it's something like football, that's kind of hard to do by yourself, but you know, you can go out and kick the ball. If it's something like basketball, you can go to a basketball court by yourself and shoot some baskets. You just have to be creative. You know, I'll say that my son likes to play tennis, which I would consider it's pretty hard to play by yourself. But he's gotten real creative. He'll hit the ball against the wall. He has a ping pong table where he sets up one edge of it so he can just hit the ball back and forth to himself. There are lots of ways. You just have to get creative. And I think it's important not to be in a rut and say the only thing I'm going to do is the thing that I did before COVID. And you may find something that you enjoy doing even more than the group sport.
That is a really good point. Thank you, Dr. Rawl. I have one last follow-up, which is if you were going to recommend a piece of exercise equipment to put in your home, given that we're not going to the gyms or some days too cold or too rainy to go out, what would be one or two of the best, maybe it's most intense to allow for you to get a workout done that way?
I would say a phone, because then you can access, or shoes or something, because you don't need equipment. If you have your own body, you can use a phone or a computer, and there are so many resources you can access online. Amazon Prime, YouTube, there's so many things that you can do, seeing somebody basically guiding you through them with your own body. You can get aerobic exercise, you know, you can do Pilates and yoga. There are hundreds of thousands of things that you can do. You don't need a piece of equipment.
You don't have to spend $3,000 for a mirror to see all of it.
No. I mean,
good point.
Yeah, and you find what works. And I don't mind going out when it's snowing or sleeting, but most people probably do. But I'm saying if that's your case, don't give up and don't say it's too cold or it's too hot or it's too rainy. There are opportunities. You can do so many things. You can do push-ups, sit-ups, squats, lunges. There's all sorts of gimmicks, and maybe you pay some money to subscribe to a Beachbody workout or Amazon Prime, but there are so many things that all you need is your body. And so if you have some access to online, you'll be able to find something.
All great ideas. Thank you.
There is another question. Is what can I do if my blood pressure is too low?
So that's a really good question. The way I define blood pressure as too low is if you can't walk or you can't talk. And that means there's not really a too low. Too low is great. Your risk for stroke, your risk for heart disease is very, very low if you have low blood pressure. Now, if you're passing out all the time, then there may be something else going on, and you could talk to your doctor. If it's too low and you're dizzy, my guess is if you can drink plenty of water, that sometimes helps, because that's the most common cause of dizziness with low blood pressure is dehydration. But there really isn't a too low. I mean, you could be 70 over 40, and if you can walk and talk, then that's fantastic.
I have question is, so I almost on the level of diabetes, but not yet. Should I eat the medicine to protect it, or not necessary?
Well, you have two options, and it kind of depends where you are in the borderline. It is true that medications like metformin will reduce your risk for diabetes. They are the same exact medications that will be used to treat diabetes if you get it. I tell people that are borderline, this is based on the data. If you can lose between 5 and 7% of your body weight, so, less than 10 pounds, if you can lose that, you can make the borderline go back to normal, 5 to 7%. So my recommendation is first to try to do it through lifestyle. Try to walk more and eat less. And if you can't get your weight down, then consider medication. Medication to me is always the second choice. My first plan is always, I call it less is more. Lifestyle, exercise, diet, those sorts of things I think will always probably get you farther. Plus you'll feel better and you'll get other benefits, not just for diabetes. You'll get reduction in cancer risk and reduction in blood pressure.
OK，Riva 医生是说这个，如果是你是糖尿病，就是还没到糖尿病，就是在这个中间的这个 number 的话，你可以利用减肥的这个如果你能减掉5%到7%的这个 weight， 5 to 7%， and less than 10 pounds， 少10磅。你就不要吃那个医生开的药，如果你能做到的话，这样对你的身体是有好处的。Do you have the borderline number?
Yeah, so we consider for the glucose value, anything that's in double digits is normal. So 99 and below is considered normal, and 126 and up is considered diabetes. So anything from 100 to 125 is considered borderline or pre-diabetes. And you may recall in one of my early slides, there's also a value called hemoglobin A1C. And for that, 5.7 and below is considered normal, and 6.5% and above is considered diabetes. And so therefore, anything from 5.6, 6.4% is considered borderline or pre-diabetes.
Oh, thank you so much. Okay, I'm sorry. I know it's over 1 minute, but there is one question.
Okay.
So what is your advice for someone who has kind of worries that exercise and lost weight might trigger gout condition?
So gout is a type of arthritis that occurs when your level of something called uric acid is too high in the body. Sometimes, like if you're exercising and you stub your toe and you're predisposed to gout, that could trigger it. But generally speaking, exercise and weight loss will help because they will lower your uric acid levels. The thing that might happen is if you get dehydrated because of the exercise, that could cause a problem. But I generally recommend to people that have gout to work on weight loss and exercise as a way of lowering the uric acid level. Just as an interesting side point, elevation in the uric acid level, which is associated with gout, is actually a marker for the risk for diabetes. So gout and diabetes is very closely correlated. I saw one more question. And the question is, besides exercise, what other methods can we improve our immune system? I think there's one extremely important thing that I haven't mentioned so far, and that is vitamin D. Vitamin D is extremely important for our immune system. Among Asian Americans who don't take any supplements, there's a 96% deficiency rate in this country. That is only 4% of Asian Americans have adequate vitamin D, and vitamin D affects our immune system tremendously. And so simply by taking vitamin D, you can enhance your immune system. Exercise helps, sleep helps, but vitamin D is important. A lot of people say, how much should I take? I generally say you should take the amount that will get you to a normal level, but if you're not having your level checked, most people I have found in my practice require between 2,000 and 3,000 units of vitamin D3 per day.
There is a last question someone was asking is how to live with
epilepsy?
Yeah.
Well, epilepsy is a seizure disorder, and I would say for that, one of the important things is seeing your doctor, and if there are medications that can control the seizures, definitely get on the medication, because the medication is really the best way of controlling the seizures.
Thank you so much. I really appreciate you are here. And
Yes. So again, thank you to all our speakers who took the time to speak with us today. Thank you to Carter and Mrs. Wu for helping organize this and help put this together. And then obviously thank you all for attending and coming to listen to our presentation and our speakers today.
非常感谢今天大家就是又来听这个健康的讲座，然后是我们可以有一些重要的这个问题，我们可以 translate to 这个 Chinese， 我们可以用中文翻译出来，然后再给大家说一下，就是这个华人的这个身体健康，然后希望大家能得到一些经验吧，然后是少走这个弯路。And again, thank you for being here. And that's all for today. And we are looking forward to seeing you next week. 谢谢 Thank you.